of myths associated with swine flu. One is that it spreads by eating pork, which is not absolutely true. It doesn't spread from food, it spreads from droplet infection, and it is just because of the name that this myth came into fact. Initially, when swine flu was discovered or labeled, it was because it was more common in the people who were looking after the pigs. So that is one myth. Another myth is about antibiotics, that if you have high fever and cough or pneumonia, you need to take antibiotics. If it is swine flu, that is not correct. Swine flu is not a bacterial disease, it's a viral disease. So if it is suspected or diagnosed, you need to take antiviral drugs and not the antibacterial drugs or antibiotics of no use. Another myth is that flu is dangerous only for adults, or swine flu is dangerous only for adults. Though it is more common in adults because they are high risk, it is also equally common in small children and all immunocompromised people, all people who have other comorbid diseases, and pregnant women. Another myth is that young people will not get swine flu, that's not true. Even young people, totally healthy people, can get swine flu if you come in close contact with somebody who's having the flu. So it is important that everyone nowadays takes the vaccine. There's a myth about the vaccines being dangerous, which is absolutely wrong. Vaccines are not dangerous. Vaccines are one of the greatest medical advances in this time. They help preventing a lot of diseases or at least reducing the severity of the disease. Some people have related vaccines to autism, which again is not really proven. Okay. Then there's another myth about natural immunity. People say that they can get the natural immunity, why should they take the vaccines? Which does not come without its own problems. You can get the natural immunity, but you can get a very severe disease if you don't take the vaccine. So if you take the vaccine, you may still get a disease, but a very, very mild disease. There is another myth saying that you should not eat cold things or warm things, but it doesn't really work that way. Food does not have anything to do with a flu or a swine flu. Another myth about eating less or eating very light diet and not eating non-veg if you are sick is not true.